I'm going to share some thoughts that I hope will be helpful for those who feel overwhelmed and perhaps inundated by all of the information that is out there regarding exercise and women's health. All the do's and all the don'ts. Research is crucial because it helps us make informed decisions as providers to keep patients safe, use effective interventions, and maintain a standard of care. It also means that we're using the best available high-quality evidence at this point in time. In research, there's a hierarchy of studies which allows us to determine if there's high-quality evidence or low-level evidence to support or not support treatments and recommendations. We also use clinical experience to tailor that information to the individual person that's in front of us, because patients are all going to have different priorities, different goals, different values. That is what patient-centered care means. There are always going to be risks versus benefits to weigh. But just because something has not yet been proven in a high-level research study over and over again does not mean it is 100% unhelpful for some. If we're not helping to support patients to also use and develop their own inner compass to make choices on what actions they want to take for their own health and well-being, then we're doing a disservice to our patients, and we're preventing them from building their own self-trust and their own self-awareness. We can help clients reflect on their body's response to treatments, foster self-awareness, educate on the interdependence of mental, emotional, physical, and spiritual well-being, and validate that their gut and their intuition is good so they can actively participate in making decisions for their overall health. Just because a random double-blind controlled trial has not yet proved that something works or has wide-range efficacy does not mean it will never show to have benefit in time. It can be tough to design a research study that considers and controls for individual differences yet still reflects the complexity for real-life conditions. We go to clinicians for their expertise and knowledge, but at the end of the day, you as the patient get to decide what you do for your body, because research evolves and it changes as new evidence emerges. My message here is to empower all of you as individuals to be individuals. Take information, look at all the pieces from high-quality, reputable resources, and choose based on what feels right for you through your own experience. Do not discount that. Things like your choice of exercise. There are so many different types of exercise out there, ranging from high intensity, slow and controlled, moderate intensity, low impact, so many. If you are in pain, or if you're working with a provider to help you balance your hormones as you head from your reproductive years into postpartum, perimenopause, ultimately menopause and postmenopause, find things that feel good and are not threatening to your body. Just because we cannot say definitively that your exercise should be paired with the hormonal phase of your menstrual cycle, like cycle syncing, does not mean you cannot explore and appreciate that the big picture of hormonal normal shifts that occur during our cycle affect our mood, energy levels, pain perception, libido, inflammation. Therefore, it's reasonable that our body's needs throughout that cycle can be different too. Chronic unbuffered stress levels and relative imbalance in sex hormones create strain on the body, and the type of exercise you do could send it more into fight or flight, which may continue to feed the underlying stress response. All exercise is great exercise, but not all types of exercise is for everyone at all times, all seasons, and all phases of life. If what you are doing is working, wonderful. Please ignore this. But if you are struggling with pain, quality sleep, energy levels, weight gain, give yourself permission to explore all the different ways of exercise and movement to get into your day. Things that make you feel good, feel safe, feel energized versus painful or depleted. Find providers that specialize in women's health and functional medicine to continue your journey of restoring optimal hormonal health. Optimal health is different than foundational health. We need foundational health, but you deserve optimal health.